awareness from the adults to the kids to the schools. Everyone's really getting involved in bringing awareness to this disease. And we thought it would be really cool if we could connect the idea of prevention. There's, I feel like there's something missing in regard to talking about breast cancer prevention. So we work with moms and women who get breast cancer, and we have incredible resources in our community that help women when they're diagnosed with breast cancer. But I feel like we don't talk about preventative steps enough.
From what I understand, that is something that is still up for debate. But, you know, I'm going to pass that over to Elizabeth because that is not my area of expertise.
Yeah, so it's a great question. It used to be 40 yearly. Now they're talking about starting it at age 50. You know, with 1 in 8 women developing invasive breast cancer, over 260,000 women will be diagnosed with invasive breast cancer. 2,500 men this year will be diagnosed with breast cancer. You know, science and the medical profession really is unclear as to when we should start with identifying breast cancer through mammograms, through ultrasounds, through thermography, and what is the ideal tool to use for that testing. That's why breast exams at home are so important.
What about the women who proactively have a surgery to remove the breast because they just have the gene? Think about Angelina Jolie. She was kind of the one best known for that.
Yep.
Is that wise to do that? Is that just for, is that certain very specific situations?
Well, I think if you test positive for a genetic link, then that's a decision you'll have to make. I think one of the statistics that we don't understand is that most breast cancer is not genetic at all. So then it leaves the question, well, if it's really not genetic to the large extent that we're seeing breast cancer, where is it coming from? I contend that it's coming from the environment and what we're doing with the environment. From radiation exposure, alcohol consumption, the foods we eat, the beauty products we put on our bodies, the chemicals we use in the foods, all of those play a role in the toxicity that our bodies have. And when we start at a very young age, eating these foods, drinking water that has tons of chemicals, all of this through a lifetime can create disease. Does it cause all breast cancer? I don't know that answer. But certainly I'm about, well, let's put in place some preventative steps. Let's talk about prevention so that women feel empowered to make decisions and choices and changes that will affect them and their girls. I hear that more and more and more. You know, breast cancer is more common in older women, but, you know, I can think right off the top of my head, 5 women in their 30s and now 40s who are getting breast cancer. So I feel like it's getting younger and younger. You know, I think that's a question for you and your doctor. And I think it's important that women become advocates with their doctor, to be a part of the medical team, to ask questions, to not be afraid, and that would be one of them. But I would think in your, you know, early 20s, if not younger, would be a good time for moms and doctors to start teaching their kids about their body and what to look for.
Absolutely. You know, I believe that it comes from several areas. To speak to your question, that could be a mother teaching their daughter. It could be the doctor working with the family as well. But also more and more we're seeing that there's education going on in the schools So girls are getting it from several different areas. And yes, absolutely get a baseline, because that way you're able to identify any changes.
Right. Yeah, so it's 1 in 1,000. So again, I think it's looking at how you're living. Like, what are your risk factors as a man or a woman for developing breast cancer? Certainly for women, gender, age, race, you can't control those things. Genetics. But again, 85% of breast cancer is non-genetic. So it's coming from somewhere. So if we can, educate, give people tools to even just think about, well, I never really thought about this. Maybe I should try this and eliminate this. It's just a forum for discussion in terms of what's going on and how we can help.
I'm hearing a lot and reading a lot lately about advances in reconstruction surgery. Apparently that is a big emphasis, and there's a lot of things happening in that area that are helping women to recover from, mastectomy